Do you suffer from low back pain? If so, you're in the right place, because today we are discussing two therapeutic options for you: massage versus chiropractic. Now, I don't believe in this myth that you need to just learn to live with pain, which is why I started this channel, so that I can give you the information you need to find pain relief without relying on pharmaceuticals. Now, if that is you, if you are popping pills daily just to get through your days, then I want to give you a gift: my 30-day pain-free jumpstart guide. It's totally free. It's a step-by-step process just there to give you a foundation of things you can do at home to ease your own pain, so that eventually one day you don't have to rely on pharmaceuticals. I've left the link down below. Now let's get into the content. Welcome to Dialectic Healing, where we discuss a fusion of physical and mental therapies so that you can obtain and maintain your healthiest self. All right, let's just do a quick anatomy lesson. Very simple. You have L1 through L5, then you have S1, which a lot of people are aware of because you do have a disc right in between L5 and S1, S1 actually being your sacrum, right, leading down into your tailbone. But then you also have your pelvis, which your pelvis and your sacrum actually have a little joint called the SI joint. And then you have all the muscles that integrate with that. On the front, the back, the sides, you have your whole core, your obliques, your low back muscles, your spinal erectors, your QL is the big low back muscle that everybody knows about. But then you've also got your iliopsoas on the front, which are your hip flexors, and then your glutes and into your hip rotator muscles. And that pretty much makes up your entire lumbar, core, low back area. Now, if you suffer from low back pain, you know where the pain is located. However, the better question to ask is, where is my pain coming from? Is it coming from poor posture, a muscle imbalance, a weakness of some kind, whether it be in your core or in your glutes? Do you have muscle immobility? Is there a flexibility issue? Or do you just have stress? Either mental stress that's now becoming physical, or have you sustained an injury so that you have physical stress that's now affecting your mental state? Where is your pain coming from? Now, if you use massage therapy for your low back pain, it is going to promote circulation, increase your flexibility. It's going to promote better posture and increase proper muscle activation. It enhances your body mechanics awareness so that it even helps to prevent future musculoskeletal issues and prevents future pain from happening. And the reason it can do this is because it's going to increase your circulation. So if you do have an area in your low back that's sustained an injury, it can help you heal from that, because your blood is the only thing that's going to help you heal. It's going to promote flexibility, promote proper muscle activation, and the mobility in your lumbar spine that you need so that you can regain proper mobility, proper flexibility, and proper muscle activation, all while easing your tension and easing any kind of stress that you might be holding, physically or mentally. Now, if you go the chiropractic route, it is going to focus on just the spine, maybe a little bit of the SI joint, but it works primarily through the bones. So if there is a misalignment or a subluxation somewhere in your lumbar area or within your SI joint, then it's going to put you back into place so that with proper spinal alignment, you can have better muscle activation because there isn't bone knocking up against bone. Everything is moving fluidly. It's going to ease any possible pressure that's on those nerves, whether you're dealing with sciatic pain or there's some sort of impingement happening. However, chiropractic doesn't necessarily help for long term. It's not part of it shouldn't be part of a weekly regimen. If you need to continually be put back in place every week, then I'm going to recommend that you go see a massage therapist, because your bones do not decide where they go. Your muscles decide where your bones go. So if your muscles are tight and continually are yanking on your bones, and therefore you are misaligned continually, then you're going to need to see a massage therapist so that you can ease that tension and possibly look at doing some different exercises to strengthen the muscles that might be weak, that aren't counteracting that tight muscle. Now, something you want to consider is that your low back pain is unique. It's not a one-size-fits-all. You might need just massage. You might need just chiropractic. You might need a compilation of both. You might need to talk to a physical therapist about gaining some exercises so that you can strengthen your core. You might need to see an acupuncturist in order to ease some of your mental stress, which then in turn eases some of your physical stress. There's a lot of different aspects at play here. So I want you to understand that your low back pain is very unique. And so it's ideal for you to not only understand where your back pain is coming from, but then also talk to the proper therapist so that you get the care that you need. I hope that this information was truly helpful for you. And if you have questions, please leave them in the comments below. If you've also tried both massage and chiropractic and found yourself unsuccessful with easing your low back pain, let's have a conversation with it. Leave a comment down below. I'd love to start having this kind of conversation. It's honestly why I started this whole channel, was to just help people with easing their pain, because it's what I do every single day at my office. And this is just a way that I can reach more people. Consider subscribing, because I am definitely going to be putting out more content related to this on a weekly basis. Until next time, may your pain be relieved.